Hi, today we are going to discuss about the cancer drugs. Cancer drugs, there are many different types of cancer drugs. Some treat cancer and others help to reduce symptoms such as sickness and pain. The type of drugs you need for the cancer depend on what type of cancer you have. You might have a combination of drugs. Knowing more about how these drugs work, how you have them and their possible side effects can help you hope with treatment. Now, how the chemotherapy works. The chemotherapy is one of the most common treatments for the cancer. It uses certain drugs to kill cancer cells or to stop them from going and spreading to other parts of your body. Your doctor might prescribe chemo by itself or with surgery or radiation therapy. You might also take newer kinds of cancer fighting drugs along with chemotherapy. You can take chemo as pills or shots. You might go to a clinic or hospital so you can get the drugs through an intravenous, what doctors call an infusion, to help your body regain strength and grow new healthy cells. You might take the drugs over a few weeks. You might take doses every day, every week, or every month. It depends on the type of cancer you have and how severe it is. Your cancer doctor called an oncologist may prescribe one chemo drugs or a mix of different ones depending on the type of cancer, whether you had cancer before, if you have other health problems like diabetes or heart, kidney or liver diseases. Next, why you need chemotherapy? Even after surgery to remove a tumor, your body might will have cancer cells. These cells can grow new tumors or spread the cancer to other parts of your body. Chemotherapy drugs help destroy, shrink, or control those cells. It might also treat symptoms the cancer cause, like pain. You might also get chemo to shrink a tumor before your doctor removes it in surgery. How it works: the chemotherapy drugs work in a few different ways. They can kill both cancerous and healthy cells, fight only cancer cells, keep tumors from growing blood vessels, which help them thrive, attack the cancer cells, genes, so the cells die and can't grow into new tumors. The common chemotherapy drugs. There are dozens of chemotherapy drugs that doctors can prescribe. They are often divided into groups based on how they work and what they are made up of. Each group of drug destroys a shrink cancer cell in a different way. Some drugs damage the DNA of the cancer cells, keep them from making more copies themselves. They are called as alkylating agents. The oldest type of chemotherapy, they treat many different types of cancers such as leukemia, lymphoma, Hodgkin's disease, multiple myeloma, and sarcoma, as well as breast, lung, and ovarian cancers. Some examples of alkylating agents are cyclophosphamide, melphalan, and temozolomide. As they kill bad cells through, they can also destroy your bone marrow in the process, which can cause leukemia a year later. To lower this risk, you can take the drugs in small doses. One type of alkylating agent, platinum drugs like carboplatin, cisplatin, or oxaliplatin, has a lower risk of causing leukemia. One type of chemo drug interfere with the normal metabolism of cells, which makes them stop growing. These drugs are called antimetabolites. Doctors often use them to treat leukemia and cancer in the breast, ovaries, and intestines. Drugs in this group include 5-fluorouracil, 6-mercaptopurine, citabirabine, gemcitabine, and methotrexate, among many others. The anthracycline chemotherapy attacks the enzyme inside cancer cells' DNA that help them divide and grow. They work for many types of cancers. Some of these drugs are antinomycin, actinomycin D, bleomycin, daunorubicin, and doxorubicin. Among others, high doses of anti-tumor antibiotics can damage your heart or lungs, so your doctor will you have take them for a short time. Drug called mitotic inhibitors stop cancer cells from making more copies of themselves. They can also stop your body from making the protein that cancer cells need to grow. Doctor might prescribe them for breast and lung cancers and type of myeloma, leukemia, and lymphoma. Mitotic inhibitors include diacetexel, exemestane, paclitaxel, and vinblastine. Another type of medicine called Topoisomerase inhibitor also attack the enzymes that help cancer cells divide and grow. They treat some types of leukemia and cancer of the lung, ovaries, intestines, among other types. These groups of medicine includes etoposide, irinotecan, teniposide, and tepotecan. Some of them, though, may raise your odds of getting a second cancer a few years later. Steroids are drugs that act like your body own hormones. They are useful in treating many types of cancer and they can keep you from having nausea and vomiting after a round of chemo. So these are the information related to the cancer drugs. Thank you.